Greetings, everyone. My name is Steve McFarlane from OET Online. Welcome to another prep hour. I'll just get everything set up at my end, but I hope this finds you well, and I hope that you can hear me loud and clear. Type into your chat boxes, everyone. Let us know where you're located and what time it is. It's here in Brisbane, where I am, it's 10 a.m. Now let me just get my turn the volume down, everyone, on my channels. Can everyone hear me loud and clear? Type in a yes if you can. Just setting up my Facebook. All right, volume's up. I'll just say greetings on the different channels. Okay, so, whoa, let's go back one. Just a sec. All right, here I am, everyone, and welcome. I can see lots of people here. Hello for staying up very late in the UK, Rekha and Anas there in Baghdad, 2 a.m. Hope I'm not disturbing your sleep. Bright and early over there in India. Well done, Jesna. Hello to Dharma in New Zealand. Very civil 12 p.m. where you are. That's great. It's 3 a.m. in Iraq. Some people like to get up. Well done for that. Hello to Camilla in Jamaica, where it's 7 p.m. That's a good time of day. Good morning in Perth. Hello in Saudi. Where else have we got? Hello there in Egypt. And hello to Gubbo in Brooklyn, New York, where it's 8 p.m. Wonderful. All different times. 3 a.m. in Kurdistan. Wow. Yeah, it's a new time slot, this one. We normally do a different one, but we're mixing it up. We're trying to capture the different locations around the world, everyone. So good to see you tuning in at the different times. It's wonderful. All right. All right, everyone. We've got quite a bit to do today, so we're going to get started. Let me just bring up my PowerPoint. And then I'll share my screen here. Okay, so if you're just coming in, make sure you like us on Facebook, subscribe to us on YouTube, and you want to know more about the courses that we offer, visit us at oetonline.net.au. That's where we are. I'm going to start, everyone, with some good news stories because today is August 14, 2020, and the results from the July 25 exam came out. Now, good news, we all know that COVID-19 is affecting all of us, and in some places more severely than others. And I know it's been really hard to book your exam, and I really sympathize with everyone who's had a bit of a delay in getting their exams booked and getting this part of your journey done and dusted. Fortunately, on July 25, there were quite a few exams held around the world. And so we got some good news stories, which I thought I would share with you. One of our regular students, often coming to Prep Hours Virginia, she's a radiographer in the UK. And we got this email from her yesterday, and she passed her OET exam with 4 Bs. Fantastic, Virginia, great work. and she has a dream to come to Australia, so, and get some sunshine, she says. So good luck to Virginia on her journey to coming to Australia. Look at that, 390 reading, 370 reading, 380 speaking, and 350 for writing. So what do you think, everyone? Good results? Would you like to get results like that? That's quite nice, isn't it? That's so that's your inspiration, everyone. Worked really hard, very, very hard-working student, and achieved those results. And another one I'll share, this just came through from New Zealand. Congratulations to Genie. In New Zealand, she's a doctor there. And I wanted to show you this one because she did the exam in May, and this shows you how you can progress, everyone. Just have a look at this. Two particular things, 310 in reading and 260 in writing in May. And then she joined our team. She joined our course. She enrolled in our standard course. She studied hard, and she got a lot of support, good resources. And she mentioned specifically she got correction from our tutor, and they even answered my questions when I emailed them. And what was the result? Well, listening went up 80 points to 390. Writing went up an amazing 110 points. So that gives you an idea what you can do if you're studying with the right course and getting the right support. Now, just remember, with our OET online teachers, we will go the extra mile for you guys. You got specific questions, you email your tutors, they're going to give you support there. And that makes all the difference. So now she's going to move forward, aiming to work as a pediatrician in New Zealand. Good luck, Genie. All right, so that's the news, everyone. Does that inspire you? Do you feel inspired? Because it's all very possible with hard work. Okay, so I'm going to move on now, and I'm going to start by, I'm just checking any comments here. Okay, so let's get into our topic today, everyone. So we're doing today writing, it's writing focus today, demonstrating professionalism and expertise. And we had our All-Stars session about a week ago, and we're on a similar topic to that, but going into a bit more detail. So how do you write like a professional? How do you write like a native speaker? You're going to be in the workplace. You're going to have to write referral letters, many of you, and you don't want people to think, well, this person, I don't really understand what they're telling me. I mean, you're referring on a patient. It's an important document. So you want to be able to show that you're on an equal footing with your colleagues. So part of that will be you building your vocabulary and learning how to express things formally. So I'm going to show you some techniques so that you can achieve that, everyone. That's our goal today, looking at some techniques to achieve that. So writing with professionalism and expertise. How do you do that? Well, there's a thing which is called nominalisation. It's a big long word, nominalisation. What does it mean? Well, it's basically putting verbs or even adjectives into nouns, and it's just formalizing your writing. So I'll give you the best way is to give you this example here. We analyzed the data from the experiment, and it revealed that children react when they have too much sugar. So we got two verbs, analyzed and react. And then if we nominalize it, the analysis of the data revealed children's reaction to excessive sugar intake. So a lot of ways we formalize this. Analyzed has become analysis, react has become reaction, and too much sugar just quite informal, medically, scientifically, excessive sugar intake. So suddenly, the preciseness, the clarity, the conciseness, all of those things, very, very important, have changed due to nominalisation. And if we count words, we've got 1, 2, 3, 4. I don't know, we've got quite a lot of words here. We've got 1.5 lines, and in the bottom one, we've got less than 1 line. So it really makes a difference and helps you write with clarity and conciseness. So that's very, very important. So it's a useful technique to help you formally summarize symptoms in a formal manner, which can aid clarity and conciseness. It helps to formalize your writing and make it more objective, fact-based, clinical, like a health professional, by removing the actor from the sentence. So we don't have we here, it's gone. A couple more examples, everyone. The medical team decided to stop the treatment. So the medical team. So we can nominalize that and say a decision was made to stop the treatment. So we remove who made the decision. A decision was made. We've gone to passive. Decide becomes decision. Second example without nominalization. We discussed whether it would be beneficial to see a specialist. We've got this we here. We've got it here again though. We had a discussion, or a discussion was held. We could also write regarding the benefits of seeing a specialist. So beneficial becomes benefits. The adjective becomes a noun. So that's what nominalization is, everyone. Anyone have a question about that? Raxa says a question I just want to ask. Letter should NBH. I'm not sure what NBH means there. I don't know that acronym. Hello to Khalil in Toronto. All right, I'll keep going. Pop in any questions as we go through, but now we're going to practice. So I'm going to get you guys to interact here. So look at the first one. No fever. So imagine we're looking at case notes here on the left. No fever, no cough, no runny nose. So my question to you all is, can you give me a formal expression? If a patient has no fever, no cough, no runny nose, what's an umbrella term? A noun that describes that. We got 1, 2, 3, 4, 5, 7 words. Can you give me a word that describes that? Yes, says, what's the purpose of nominalization? Yeah, to make the sentence look good and scientific. Exactly, because that's what medical writing is. It's scientific writing. All right, that's what it is. Here we go. Nebchi and Marketa have come in very quickly, and they've said no fever, no cough, no runny nose, asymptomatic. So then we can write a sentence. Mrs. X was asymptomatic. Lovely, concise, and very formal. A lot better than saying Mrs. X had no fever, no cough, and no runny nose. That would be a bit over-reliant on the case note. So it's a way of demonstrating formality, everyone. All right, next one. A bit similar, no fever, no temperature. How would you summarize this, everyone? Type in what you would do. No fever, no temperature. Well done, Nadeshiani. Afebrile. Mariget got that as well. Hajinda, lots of people got it. So you know all these words. So this is what OET is all about. using your professional language. Mrs. X was a febrile. Okay, so less reliant on the case notes, more fact-based, more clinical. Let's keep going. Symptoms suggest acute colonic pseudo-obstruction. So we can change the word suggest. Suggest is a verb. What's the adjective of suggest? Does anyone know that? The adjective of suggest. That's a good sentence, Helen. So type in, everyone. The adjective of suggest. Adjective of suggest. Suggestive, well done. It's coming through now. No, suggestion's a noun, Nevchi. We're going to go for the adjective, suggestive. So then we can write the symptoms were suggestive of an acute colonic pseudo-obstruction. So that's a really good idiomatic expression to learn. The symptoms were suggestive of an acute colonic pseudo-obstruction. Okay, becoming more formal and very precise, everyone. Next one. Now this is, do we have any dentists with us today? We've got a couple of dental examples here, everyone. Look at this one. Tooth 26, sensitive to hot and cold. Not too serious. There should be another O there. Not too serious. Let's just put that in, everyone. And not too serious. Now, whenever you see this, I'll just show you this. This is patient language. If you're looking at case notes and you ever see something in inverted commas, particularly under subjective, that's paraphrasing what the patient said. Oh, dentist, it's not too serious. But that's patient language. You don't want to use patient language when you're writing your referral letters. You want to use professional language. So we need to do that here. So let's look at some a noun for sensitive, everyone. Sensitive. What's the noun? And then not too serious. How could we say if something was not too serious? If we're talking about tooth 26, sensitive to hot and cold. What are we going to do here? This is a bit of a tricky one. Just give everyone a second to do this. Any suggestions? Sensitive, what's the noun for sensitive? And if something's not too serious, it is? Owen's gone sensation. No, slightly mild. Yeah, it is a sensation. I'm looking for a different word though. Christelle's got it. Well done, Christelle. Sensitivity. And Michael's gone for mild, for not too serious. Yes. There we go. So then we can write a sentence. The patient reported. What did the patient report? Not too serious, sensitive to hot and cold. So when cold wind, maybe a hot cup of tea is affecting that tooth. I think we've all experienced that sort of pain. So let's see. The patient reported, what type of sensitivity was it? Yeah, mild sensation. People are coming in with that, which is good. Have a look at this one, everyone. The patient reported a mild sensitivity. Well done, Raquel. A mild temperature sensitivity. So hot and cold, temperature. That's summary skills, everyone. And look, the other thing that you should notice when you see this, it really blends in. We use the verb reported. So remember this, report plus noun. We report something. The patient reported a mild sensitivity. Much more formal than saying the patient said that they were sensitive to hot and cold, but it was not too serious. That would be quite informal. But this is medical writing, everyone. What do you think? Nice sentence? You can imagine if you're writing like this on exam day, if you're summarizing in this way, it's very clear. When you send that in your referral letter, and your audience, your reader picks it up, very clear, very precise. That's what you're aiming to achieve in your writing, everyone. Okay, this one, 12052226, permanently restored. So again, we're looking for a noun of restore. What's the noun of restore, everyone? The noun of restore. Have a think about that. The noun of restore. We're talking about a tooth. It's a bit of a tricky one, this one. 12052226, permanently restored. So it's back in, it's fixed. That means it's a, what is it? There we go. It's coming in restoration. So if I'm going to use that, I'm going to change the adverb, which is describing the verb permanently restored. That's an adverb permanently describing the verb restored. But in this case, we're going to use an adjective to describe a noun. It's a permanent restoration. So permanent restoration of tooth 26 was completed on 12/5/20. There you go, dentists. Couple of good sentences for you on how to write with formality. And if you are a dentist watching this video, don't forget, we have excellent courses for dentists, including writing specific classes where we really analyze the language, everyone. This is what good preparation is like, that detailed analysis. Next one, Mr. Z complained of osteoarthritis in both knees. Okay, for many years. R more than L, right more than left. Okay, can you give me a medical term? Give me a medical term for both knees. What type of arthritis does this patient have? Can you give me a medical word for both knees? And someone wrote, Sunil Wright was performed. That's a good sentence as well, Sunil. We'll accept that. Lots of options there. So now we're looking for a word that describes both knees. This is the patient's word. The patient's complaining of, oh, doctor, got this terrible pain in my joints in both knees. Bilateral. Thank you, everyone. That's the medical word. Predominantly, right? Bilateral. Yes, very well expressed, sir, or ume. So a long history of bilateral arthritis. And look, for many years we say a long history. Mr. Z reported a long history of bilateral osteoarthritis with the right knee more affected than the left. And you could even shorten that, as other people have mentioned. I'm sure as health professionals, you've even got other terms, predominantly on the right side. So there's ways of doing it. But look at this sentence. Let's just analyze that. It's exactly what you're looking for, everyone, when you write. Mr. Z reported a long history of bilateral osteoarthritis. That's clinical writing. That's subjective writing. Very different to patient language. Yeah, I would say Abdullah writes predominantly the right than the left. No, predominantly on the right side. If you use the word predominantly, we don't need to mention the left. Helen writes, has had a long history. No, we don't need has with history. Just has a long history is enough. We don't need, because history gives us the timeline there. That's for you, Helen. And bilateral knee joints arthritis. I'll pick up on that one, everyone. Knee joints arthritis. We don't need joints there. Bilateral knee joint arthritis, because when we just show that to everyone, bilateral knee joint arthritis. A lot of people want to put that S here. I see this a lot. Knee joints arthritis, because there are knee joints, arthritis in her knee joints. But when we make it into a, it's called an attributive noun. It's functioning like an adjective. It's talking about a type of arthritis. So we don't pluralize that S. Important one to remember. All right. Sheriff Eden writes bilateral knee. I think we need to say bilateral arthritis in the knees, perhaps, Sheriff Eden, and good to see you here. Okay, now, next one. Patient complained of breaking wind last 3 days. Oh dear, can you give me there's a lot of slang for breaking wind, but we don't really want to use that type of language in our formal letter. We're being professional, obviously. Can you give me a formal word, not a slang word, a formal word for breaking wind? If you don't know the formal word, welcome to put in the slang. There's lots of slang for breaking wind. But what would you say medically? Flatus, thank you, Abdullah. Yes, flatus is one of the words, and there's another word I think is going to come through. Who knows what it is? Gubbo, that's a great sentence. It's not a fracture, Amir. Yeah, flatulence. That's the one I was looking for. I was looking for the word flatulence, everyone. Flatulence. There we go. So if I put it into a sentence, the patient last 3 days. Oh, this is a really hard one, everyone. How can we paraphrase this term? Last 3 days. How can we paraphrase that? Last 3 days. What type of history is that? Look up here, everyone. We've got a long history here. A long history here, because we said many years. But now we don't have a long history because it's only 3 days. What type of history is 3 days, everyone? Can anyone give me a word for that? Prolonged history? I think that sounds good. Alnor, that's a good expression there. A 3-day history of, well done, Dina, that's good. A 3-day history of. Yes, a recent history. That's the one I like. A 3-day history is good for those people writing that. A short history, I probably wouldn't say. Look at this one, everyone. The patient reported a recent history. So really good piece of advice for everyone here in the audience. Really practice your expressions associated with the word history. A strong history, a positive history, a recent history, a poor history. There are many types of history, but it's a really common way to write medically. So building up your vocabulary in that area. And the other thing you'll notice, look how often we're using the word reported. Really good for subjective language. The patient reported the mild temperature sensitivity. The patient reported a long history of. The patient reported the recent history of. We can follow these patterns. Shalini says, can we use complaint of? Yes, you can. The patient, and that's a good point you make. Complained, we can often replace reported for a bit of variety. We can say the patient complained of, because it's also complain of something. So you just got to learn these patterns. Not complaint, by the way, Shalini, we're going to say complained of as a verb form. Short-term history, quite possible, Amira. Well done. All right, excellent. Let's keep going, everyone. So now we've got a few tricky ones. Treatment, and we've got an arrow up, increase. Fluids, Gargle with salt water. Now, this is challenging. We all know gargle is a verb, right? Gargle. It's one of those funny English words, isn't it? Gargle. It's actually like onomatopoeia. It's the sound. Gargle actually is the sound of the action, gargling. How would you write it, though? Well, let's have a look, everyone. I'll do this one for you. So, arrow up fluids. Increase fluid intake. Increase fluid intake. That's a formal way. The patient needs to increase their fluids. They need to increase the fluid intake. And we can say gargle, but we can use the verb do. Gargle with salt water, do salt water gargles. Bit tricky. In terms of treatment, Mrs. Y was advised to. Now let's study this language, everyone, and make your comments. In terms of treatment, Mrs. Y was advised to increase her fluid intake and do regular saltwater gargles. All right. Now, I'm just going to, while we're looking at that, everyone, I'm just going to do a little bit of live correction, everyone. Well done, Alna, for typing in your sentence, but I think I'll help you with it. It's a great chance to address anything. Look, the patient complained of flat since couple of days. So this is the problem. Couple of days, everyone. The patient complained of. You can't say past. That's informal writing. I can say over. You can't say couple of. Over the past 2 days. We could say that, or 3 days, whatever. Well, it was 3, I think. Couple means 2. So over the past 3 days. Now, we can write like that. It's fine. But just be careful. Couple of is informal. That's what you've got to learn. Over the past 2 days, that's it. All right, so just be aware of that, everyone. It gets really tricky. You've got to learn that vocabulary. Good, Sunil. That's a good sentence. She was advised to stay hydrated. Excellent. Excellent, Harjinder. Okay, but let's check this. In terms of treatment, Mrs. Y was advised to, and then to what? Well, we need a verb after to. Was advised to increase. That's our infinitive form. Was advised to increase her fluid intake. We've put the pronoun her. And do regular saltwater gargles. All right, so we can do saltwater gargles. That's tricky. Gargle sounds informal. Well, that's why we've turned, it's informal, Gabbo, if you use it as the verb. I asked the patient to gargle, but if we turn it into the noun, then it's a little bit more formal. But if anyone knows another word instead of gargle, I would be pleased to hear it. I've never heard it. I've never heard it. So mouthwash, possibly, yeah. Okay. But I think it's quite precise. Okay, next one. This is an OT one. Any occupational therapists with us? Assess Mr. X's workplace. OT is going to do it. Assess and evaluate. Can you give me the nouns for these 2 words? And while we're at it, let's do the next one. Comply and adhere. Can you give me the nouns, everyone? Assess, evaluate, comply, adhere. What are the nouns for these words? Nilishma says, gargle regularly with salt water. Excellent, Nilisha. Nevati's coming through. Assessment, evaluation. Yep. Only Rekha asked about increase. Increase is a verb there, Rekha. So no article to increase. I wouldn't say salty water, Al. No, that doesn't sound good. We wouldn't say salty water. You put salt in the water, but salty water sounds like seawater. All right, lots of great words coming in from everyone. Yep. Assess is assessment. Assessment. Evaluate, evaluation. All right. could you please conduct an evaluation of Mr. X's workplace? Now here, the purpose of this one is conduct, everyone. You conduct an evaluation. So that's your collocation, everyone, knowing which verbs go with which noun. So that's part of your vocabulary building. You need to know which verbs go with which nouns. Mr. X not able to comply with, adhere to his medication regime, monitoring required. So people wrote it. Comply becomes compliance. Adhere becomes adherence. So I'm sure you've all had non-compliant patients who do not want to do what they're told. They resist your advice for whatever reason. So we can say, and we're going to use a complex sentence here, everyone. Due to okay, here's a challenge for everyone. I'm going to give you time to fill this word in. It's another type of history. Due to a something history of medication compliance. Now they're not complying. So what type of history is it? Very tricky one. They're not complying. That's the hint. Due to a something history of medication compliance, comma, something. Yes, we could say non-compliance. That's due to a history of non-compliance, but I haven't written that. I've reversed it. Does anyone know? Lack of, positive, no. Wow. You're onto it. Roman, you're doing well. You've got it. Well done, Nedeshani and Shalini. Yes, due to a poor history of medication compliance, monitoring is required. Now, I could reverse that, couldn't I, everyone? I could do this. I could just simply say, due to a history of medication non-compliance. Of course, I could do that, but I'm just showing you a little bit of variation there, everyone. A little bit of variation. Poor compliance, exactly. And poor is a formal word, everyone. Poor is a formal word. Gabby writes a fair history. Now, I wouldn't call it fair. They're not complying. It's worse than fair, but poor is formal. Patient has a poor diet. So poor is one of those words that's actually quite formal. Okay, keep going, everyone. Examination. Baby has not been able to put on weight. Refer to dietitian. So this is a hard one. Have a go at this one, everyone. Weights are always difficult with things like weight. Baby has not been able to put on weight. Refer to dietitian. Baby has not been able to put on weight. What's happening here with their weight? Can anyone express that formally for me? Not being able to put on weight. What's happening here? The hard one. Lack of, yeah. Lack of what, though? Have a think about it. Two more words. They're underweight, yes. But the point is they're underweight, true, but not being able to put on weight. As a health gain, good. I'm going to use that word. I'm going to use your word. Well done there. Not gaining weight, that's good. Now I need one more word, everyone. What type of weight gain is it? Lack of proper diet, but we don't really know that, Comenia. What type of weight gain? Has not been, no, that's good try, but not. Difficulty in gaining weight is good. Inability to increase weight, nice, Rachita. Gaining, it's a hard one. How would you describe, think about it like this. How would you describe the weight gain as a health professional? How would you describe the weight gain? That's what we're trying to do. We need an adjective. An adjective. How would you describe the weight gain? Slow weight gain? Yeah, not bad, Heidi. Poor weight gain? Yeah, but that's not quite right. Steady? No, because it's not steady at all. It's not going up. Decreased weight gain? Quite good. Quite good. Cherry. Well, Cherry. That's the best so far. Well done, Cherry. Insufficient weight gain. Beautiful. Failure to thrive. Yes, that's often used, that term, isn't it? Inappropriate. No, it's not about being appropriate. Okay, here's my word, everyone. This was a hard one. Inadequate weight gain, everyone. How does that sound? Inadequate. Same as insufficient. Inadequate. It's not about being proper, as some people are putting in, but there you go, everyone. It's inadequate, insufficient. So when we put that into a sentence, we're going to say we've got to fill some gaps here. Again, due to is quite a common word in medical writing. Due to inadequate weight gain, referral to a dietitian is recommended. All right, any dietitians out there? I know there's often a few. We also have lovely courses for dietitians. Due to inadequate weight gain, referral to a dietitian is recommended. All right, so that's a skill you can develop, everyone, through practice, studying all the case notes, going to the OET Center website, everyone. There are many sets of case notes on the OET Center website. I strongly advise you to study the vocabulary and build and make note of all this great language you can use to formalize your writing and sound like a professional. Right? Sound like a professional. Poor nutritional status is good, Alma. That's a great expression. Doesn't actually summarize the case notes, though. We're trying to get the baby has not been able to put on weight. All right, now just a couple more things. Time. Medical referral letters, it's all about time. You've got the patient's history. Things are happening over a period of time. And time can be quite challenging to describe. So let's look at some expression that will help us write formally. So let's look at this one. Mrs. X came to the clinic twice last week. Came to the clinic twice last week. Okay, so twice last week. She visited the clinic on something. Can you capture the word? She visited the clinic. There's a hint. She visited the clinic on to something. What's the missing word? She visited the clinic on to something. Have a think about that. The notes I just mentioned while I'm waiting, if you go to the OET Center website and look at their practice sample tasks for writing, lots of model letters for 12 professions. Just go through all the model letters and extract the formal expression and add it to your notebook and learn. Good, Bidur and Sheila. Manhur is getting it. Yes, Mohammed, lots of people are getting it. Some people saying occasional, no. Two separate occasions. Mrs. X presented at the clinic on two separate occasions. Much better than saying Mrs. X visited the clinic twice last week. On two separate occasions, or simply on two occasions. Suddenly, very formal. Two times, nice try, Yan, but not really formal. On two occasions, on two separate occasions. Okay, another really hard one, everyone. We've got this word, sometimes. Give me a formal word for sometimes. NJ Rob says consecutive. Not really. Consecutive is a great word, but we're not trying to display that or express that. Okay, sometimes. Often, no. Nice try, Shalini. Mr. Y is confused, is often confused. Possible. Possible. Is there another way of saying sometimes? Occasionally, that's pretty good, Abdullah. Yep. Infrequent, Tamer, and hello, Tamer. We don't know whether it's infrequently or not here. At times, Sheriff Ferdinand, yeah, this is the one. It's at times. So the formal word of sometimes is at times. Mr. Y reported that he experiences confusion at times. There it is. He reported that he experiences, now we experience things. We experience pain. We experience confusion. We experience nausea. So there again is your collocation, that word experience. You can use occasionally, Nadeshani, but I think at times a very lovely word. Okay, advice, exercise every day. Can you give me a synonym for every day? Every day. Good, Alnor. Initially, no. Daily, yeah. Shalini says daily. Exercise daily, yes. Anything else? I want to go a little bit more formal than daily. More formal than daily. Regularly, nice, Neptune, we can use that. Keep trying. Occasionally. I want 2 words. I'll give you a hint, everyone. On a daily something. On a daily something. On a daily what? Daily basis. That's the word we're looking for. Imagine we're giving advice to a patient. It's important that you exercise on a daily basis. This will be good for your speaking role play. It's important that you exercise on a daily basis. All right. Hard one, everyone. This is a challenge. Fairly, CT scan, normally, this is a fairly quick procedure. This is for radiographers. Any radiographers out there? CT scan, normally a fairly quick procedure. What does fairly mean? A fairly quick procedure. A fairly quick procedure. What are we? Quite good, Rachita. Yes, and I'm going to use a different word, everyone. I'm going to use a different word. It's quite quick. Yes, the procedure is usually quite quick. But I'm looking for a different word. Catherine, not sure. Very, no. Minor, no. Strictly, no. Normally, yeah, is excellent. A tick, normally. Now I'm going to use a different word. I'll bring it up for you, everyone. It's normally hang on. Under normal circumstances. Whoops, keep going. Under normal circumstances, a CT scan is wow, Yan, you got it, is a relatively quick procedure. What does that mean, relatively quick? It means in comparison to other procedures. Relative, what is it relative to? Relative is like relate. It's relative to other procedures. Other procedures are longer. Can anyone tell me what's a procedure longer than a CT scan? Are there procedures that take longer than a CT scan? And normally, look at normally, under normal circumstances. Lovely. Comparatively, article, that is fantastic. It's a comparatively, because we're comparing, aren't we? Everyone's saying MRI. Yeah, MRI takes longer. So that's what it's comparing to. Okay, symptoms started gradually. I'll do this one for you, everyone. Symptoms started gradually. There we can say there was gradual onset of symptoms, or if symptoms started suddenly, sudden onset of symptoms. Look at that formal nominalization, everyone, with the of. Gradual onset of symptoms, sudden onset of symptoms. Mr. Z reported a gradual onset of symptoms. So we're using a lot of these similar expression here because that's what you use for formal writing, everyone. All right. Okay, I hope you're taking notes, everyone, so you can apply this to your own writing. Let's keep going. Now, so now we've just covered that. Just the last thing to do here. We don't always have to nominalize. I've just showed you how to write formally. But what if the case notes, often the case notes have nominalized expression, but you might want to add your voice. You might want to use an active structure so we can denominalize. We don't always want to sound, like it's great to sound clinical and objective, but we lose our voice. If you want to make it real, sometimes you want to denominalize. You don't have to nominalize everything. So you might see the case notes with nominalized forms, but you want to add your voice or that of your patients. And this can help bring the case notes to life and make it real. So it's not just one-way traffic, everyone. First one, gluten-free diet until resolution of symptoms. Resolution can be turned into a verb, resolve, until resolution of symptoms. So we might write that the patient was placed on a gluten-free diet until her symptoms resolve. Now you're focusing on the patient. Nice way to write, everyone. Subside is also a good word. All right, and look at, for your collocation, everyone, pay attention here. Was placed on a diet. So we place someone on a diet. So you've got to learn the correct verb with the correct noun. Next one, biopsy results, characteristic findings of flattened intestinal villi. I'm not sure if I pronounced that correctly. Findings, we can change indicate or reveal the findings. So that's the noun. The biopsy result indicated flattened intestinal villi. So you don't have to use the nominalized form. You can denominalize it, everybody. Can we say placed on for medication as well? Yes, you can. Atik, yes, you can. He was placed on antibiotics. Perfect. All right, this one here, treatment advice, wet combing technique, eradication of head lice. We want to eradicate that head lice. No one likes head lice. Eradication becomes eradicate. The wet combing technique will help eradicate the head lice. Good for giving advice. Denominalize, everyone. Another one on, well done, Ogochukwu. Hard to pronounce your name. Another one, and this is on the old head lice. Between treatment, removal of all eggs with a lice comb from scalp necessary. Removal, remove. It is important to remove all the eggs from the scalp with a lice comb so we can denominalize. And this will happen on your case notes, everyone. You will see case notes where you want to denominalize. Last one, assessment required before commencement of therapy. So assessment, assess, commence, commencement, commence. Could you please assess Mrs. Y before we commence therapy? All right, so you can denominalize everyone. So I think it's important when you're doing your writing that you're aware of these things. And it's a two-way process. Common to nominalize, to create formality, the clinical objectiveness. But on the other hand, giving advice or adding your voice, you may choose to denominalize. So what you're looking for in your own writing, everyone, is that flexibility. Flexibility to go both ways. Practice these skills. Practice these skills. All right. Any questions? Any questions? All good? So look, come and join us at OET Online, everyone. You want to fast track your performance, enroll in one of our courses. We do constant weekly analysis of this sort of stuff online in our classes. I can see a few OET Online students with us today. Thank you for joining me for this session. And I'm just going to go through a few more things now. I want to make a little bit of an announcement, everyone. So look, we're big news, you know, OET is now accepted in America. Fantastic. United States. Anyone here in the audience aiming to go to the USA? You might be a doctor trying to get your ECFMG registration. You might be a nurse looking at getting registration. I think Florida and Oregon are accepting nurses from the end of this year, and you might be watching this video. So I just want to let everyone know, starting from August 24, you've heard it first here, we're going to increase our number of virtual classes, everyone. We're going to increase it. So we're now going to run 2 live classes per day because people are all over the world. So we're going to go for great times. So if you're looking, some of these times, everyone, so we're going to have 3 time zones, but we're going to do 2 every day. So we're going to have 1 a.m., 11 a.m. and 7 p.m. in the UK. USA, there'll be a 6 a.m., 2 p.m. or an 8 p.m. class, depending on the round. Middle East, 3 a.m., 1 p.m., 9 p.m., different time zones there. India, 11:30, 5:30, 3:30. And Singapore, 3 a.m., 8 a.m., 6 p.m. And lastly, if you're in Australia, 5 a.m., 10 a.m., 8 p.m. So class will be running 2 of those slots every day. So you can always attend a live class. So you're never going to miss it. But you've got to come to our website, oetonline.net.au, to join in these classes. Starts August 24, just 10 days away. So we're doubling the classes, everyone. So the classes won't be too big. We're not going to have overflowing class sizes. That means you can practice live, text in your writing, your responses, and get that personal feedback. How does that sound, everyone? How does that sound? And apologies if I haven't captured your location on this map, but I think you can work out the time zones. All right, and a little bit more. I want to introduce a brand new course, everyone. A brand new course. A lot of people have trouble with writing. It's called Virtual Writing Class Ultimate. So this is a brand new one. It's got the unlimited live virtual classes. It's got 2 private writing tutorials, 1 hour long, 8 writing correction, grammar and vocabulary clinic. It's for all professions, 6-month access, Australian $395. That's under 300 US. But this is a great course if writing is your nemesis. If you really want to fast track and you've done the other skills, check this course out. It's available now. And I think those 2 private writing tutorials will be very beneficial. What will we do in them? Well, we'll check your submissions and do live correction with you and discuss your grammar. And in the second half an hour of that session, we'll plan your subsequent letter. It's a really good way to fast track if you're in a hurry, everyone. So check that out. Brand new course, everyone. And then we have our normal ones, Virtual Writing Class Platinum, Virtual Writing Class Standard, might suit your budget. And of course, we have Writing Correction Service. If your exam's really close and you just want to be able to get some writing corrections, great value there. 5 corrections, just 112 Aussie dollar. Good price. Now, of course, we have courses for all skills. So check out the website, everyone, oetonline.net.au. Come along and do that, and I'll just type that in for you. It's HTTP. That's where you go, everyone. Just typing it in for you. Visit us. Study with the best, and we will help you pass your exam like you saw those other people at the beginning, everyone. Any course for reading. We got great courses for readings with teacher support as well. Jalise, is any good package for reading and writing? Look, in my opinion, everyone, if you're going to combine two, if you've got 2 skills, we've got great courses. So enroll in 2 courses separately or do the whole package, all skills. It probably works out at a better price. Just visit the website. All right. Winnie says you like the new schedule. Excellent. Oh, we think the new schedule is going to be fantastic. So check it out, sign up, and you will pass OET. We'll help you and we'll guide you. Team effort, everyone. All right, we're done. I'll be back in a couple of weeks, everyone. Look forward to helping you achieve your goals. Bye for now.